National briefing for Friday, 15th May 2020. We'll start by taking the remarks of the chairman of the PTF COVID-19, as well as to be followed by the updates from the Minister of Health, the DGN CDC, and the National Coordinator, before we take the questions from the gentlemen of the press. Today we'll make it very compact and we'll go straight to the point. I now invite the chairman of the PTF COVID-19 and Secretary to Government to please make his remarks.
Members of the Presidential Task Force, distinguished ladies and gentlemen of the press, again, our sincere apologies for coming late. But you would understand that we are in very difficult times and there was so much to cover this morning. However, I welcome you to the national briefing by the Presidential Task Force on COVID-19 for Friday, 15th May 2020. When the COVID-19 pandemic was declared, corporate bodies, development partners, individual groups, religious bodies rose up massively to make donations in cash and in kind. For effective coordination and accountability, the Office of the Accountant General published 5 bank accounts into which donations could be paid and swept into the Central Bank TSA account on a daily basis. Consistent with the open government policy driven by transparency and accountability of Muhammadu Buhari's administration, the Presidential Task Force promised that details of all cash donations would be publicly provided. I'm pleased to report that the Office of the Accountant General has published the details of inflow into the federal government COVID-19 eradication support account. As at 14th May 2020, the sum of 791,613 naira 89 kobo has been credited into the TSA account from the various in-country sources. I particularly want to commend the sacrifice of some ordinary Nigerians, typified by the donations as low as 1 naira, which for us comes from the purest of hearts. As we progress in our battle against COVID-19, the Presidential Task Force wishes to extend its appreciation to several other groups that have been supportive in the discharge of its mandate. We must recognize the support of the Nigerian police as the lead agency leading the armed forces, the intelligence community made up of the DSS, the NIA, the CDI, and the paramilitary services in maintaining security, carrying out enforcement, and staying in the front lines always. I also wish to appreciate the Nigerian Air Force for providing the airlift logistics that has made it easy for surveillance and surge support mobilization by the Presidential Task Force and the Nigerian Center for Disease Control, even at very short notice. Mention must also be made of the offer by the Lagos chapter of the Federation of Tourism Association of Nigeria to make hotels available to the Lagos State government for use as isolation centers. Similarly, we recognize some airlines such as Dana, Aero Contractors, and Bristol Helicopters who have offered to provide support for the movement of logistics and supplies. This morning, the Presidential Task Force held consultations with the United Nations Resident and Humanitarian Coordinator and his team to strengthen our coordination efforts with the United Nations system in Nigeria and building especially on their global reach in all aspects of the fight against the pandemic, from the scientific, humanitarian, and through supply chain management in the recovery plans. The Presidential Task Force congratulates and appreciates the testimonies of Nigerians who have recovered from COVID-19, which has given us more insight and further strengthens the need to adhere strictly to guidelines issued. However, an emerging issue from all these testimonies is the issue of prescription for treatments. We should always remember that the symptoms of COVID-19 mimic some illnesses we already know, but treating the symptoms is not the same as treating the virus. And for this reason, we strongly discourage self-medication. We shall continue to encourage all Nigerians that feel the symptoms to test, and if positive, go into the isolation centers for care by experts, as we have received from the different persons that have testified. They first tested. When they were confirmed positive, they went into isolation centers and received care. We still discourage management of this infectious disease by private hospitals, except they have received accreditation due to the risk of infection. On the issue of drugs for cure, I am pleased to inform you that 5 states in Nigeria are participating in the ongoing WHO Coordinated Solidarity Trial. At the end of this, relevant health authorities will make statements on acceptable drugs for treating COVID-19. Ladies and gentlemen, for some time now, public discussion has centered on the need to look inward for local cure. Particularly, the social media has been awash with various claims for treatment of COVID-19 using local herbs. The Presidential Task Force remains firmly supportive of the development for a cure for this disease. However, we must follow laid-down protocols. The National Coordinator has been mandated to publish some of these guidelines for public consumption. I do hope this will shift the conversation to the laboratories while we await results for the greater good of the nation. As additional information, I am pleased to inform you that the WHO recently coordinated a virtual meeting from 70 traditional medicine experts from countries across Africa to re-emphasize the recognition of the potency of traditional cure. In providing leadership for the fight against this pandemic, Mr. President did encourage state governments to adopt national guidelines as suitable to their states and expect that such adaptation should be informed by empirical evidence of progress made. The Presidential Task Force therefore urges states that are lifting restrictions which allow for large congregations of people to weigh their consequences in relation to creating opportunities for more seeding of the virus, thereby negating gains already made. The Presidential Task Force has received media reports about an extrapolated level of prevalence of COVID-19 in Kano, based on the number of some foreign nationals that have been evacuated from Nigeria. The Presidential Task Force team of experts are still on ground in Kano and are working round the clock alongside the teams from the state based on scientific and statistical analysis. I urge members of the public to remain vigilant and seek authoritative information from the public health authorities at all times. We have also noticed a marked reduction in the delivery of non-COVID-19 related services in our hospitals. You will recall that the Honorable Minister of Health had on several occasions implored our health institutions not to jeopardize offering critical health services to patients who require attention. The Presidential Task Force wishes to reiterate this call and request that health service providers should help relieve the burden of the disease in the country by offering required services. As at present records show that we may be experiencing more unnecessary deaths because our hospitals are turning back non-COVID-19 related patients. As we continue the countdown to the end of the first phase of eased lockdown approved by the President, the centrality of coordination, especially with the citizens, become very imperative. Our national response has always been guided by the science of the pandemic, as well the extent to which applied measures are helping to contain the virus without compromising basic elements of life sustenance. Going forward, science and statistics shall play major roles in the decisions to be taken. Similarly, community engagement shall become a strategy of focus for the Presidential Task Force. Finally, let me say that our preliminary analysis has narrowed down the over 51% of the total number of infected persons to 9 local governments across the country, and all of them are densely populated. This indicates that a critical element of our timing of the pandemic is to reduce opportunities for large gatherings, sustaining the ban on interstate movement, the nationwide curfew, and complying with the measures prescribed, washing of hands as frequently as necessary, use hand sanitizers, maintain social and physical distancing, use a face mask or covering in public places. In the coming days, the Presidential Task Force shall submit its recommendation to the President for consideration. Until a decision is announced, we advise you to please, if necessary, stay at home and stay safe. I now call on the Honorable Minister of Health, followed by the DG, Nigeria Center for Disease Control, and the National Coordinator to give you the necessary updates. And I thank you for listening.
Good afternoon, everybody. The Secretary to the Government of the Federation and Chairman of PTF, Honorable Ministers, Permanent Secretaries, Directors and Directors General, ladies and gentlemen of the press. By way of update, 193 new COVID-19 cases were confirmed in the past day in 15 states: Lagos 58, Kano 46, Jigawa 35, Yobe 12, FCT 9, Ogun 7, Plateau 5, Gombe 5, Imo 4, Edo 3, Kwara 3, Borno 3, Bauchi 1, Nasarawa, Ondo 1, bringing the total number of confirmed cases in Nigeria over the 5,000 line to 5,162 in 34 states and the FCT. Till date, 1,180 patients have been treated and discharged from hospital care, and 167 deaths have been sadly recorded. The case gender ratio remains about 70 to 30% for men and women respectively, while case fatality hovers around 3%. A steady rise in these figures is what we envisaged, with more diligent testing, treatment, isolation, and tracing. Ability and capacity to keep up and align these activities with each other will determine the course of events as time goes on. We implore states and partners not to relent, but to keep up with the pace, which in some states will increase well before it begins to decrease. Adherence to advisory against interstate travel and compliance with other simple measures like the use of masks and avoiding crowds will significantly mitigate the burden. The situation in Kano has largely stabilized, as you heard from the chairman, thanks to the good relationship between the visiting federal task team and the Kano State Task Force on COVID-19. One manifestation of this being the high number of new cases recorded daily from the fact that all labs in Kano are now functioning and clearing the sample backlog with over 350 tests that can be done daily. The state government has been doing well in opening up more treatment and isolation centers. A strategy document of the National Primary Healthcare Development Agency is being developed and repurposed for application to Kano, but also to similar high-density, high-burden metropoles like Lagos, to respond more specifically to the challenges of COVID-19 tracing, tracking, testing, isolation, and treatment in congested communities. If implemented, it could go a long way in addressing many challenges looming before us. An innovation of the Federal Ministry of Health in Kano, of the Kano Task Team, is the training of journalists to take place tomorrow, the aim of which is to ensure that reporters are in a better position to interpret COVID-19 related data and information, and also learn to take necessary infection prevention measures. I shall use this opportunity to thank His Excellency the Governor of Kano State for providing the necessary support for the federal team to function. A Federal Ministry of Health team has been assembled to proceed to Sokoto and Borno on fact-finding and support missions to engage with state authorities and determine material and technical needs. A most immediate probability is the prioritization of these states for the deployment of the repurposed gene expert machines as soon as we start receiving the cartridges in a few weeks to bring speed to testing. As mentioned earlier, part of the mission in Kano is to assist state pathologists and scientists to unravel the mysteries around unexplained deaths in some states. The tools for the forensic investigation have been jointly developed for a uniform approach and balanced results. We have been able to persuade the popularly known Benue lady to allow a test sample to be taken to our laboratory for testing. The result is being awaited any time now and will be given to her in person. Please note that while a patient may disclose their result by themselves, the Federal Ministry of Health cannot and will not do so, except it has the permission of the person concerned. The annual World Health Assembly, which is held every year in Geneva, shall begin on Monday, the 18th of May, and hold this year for the first time by teleconference. I shall be leading the Nigerian team to the virtual meeting, the focus of which is expected to be the global spread and response to COVID-19, requiring individual, collective, and national effort. Finally, I shall reiterate again the importance of adhering to public health advisories, wearing our masks, observing social distancing, practicing hand washing or sanitizing, standard respiratory hygiene, avoiding crowds, and above all non-essential travel. The importance of these and similar measures is such that compliance should be taken as a civic duty and obligation for every citizen, where each should be responsible for the other. As such, enforcement or policing should not be necessary for what is meant to preserve life and health. Therefore, I call for considerate attitude and social adjustment to the challenges we face at this time. Thank you for listening.
Chairman of the Presidential Task Force, honorable ministers, gentlemen and ladies of the press, good afternoon. Thank God it's Friday. I know you've had a long week, so have we. So I thought that we'll keep today fairly upbeat and talk about what I tried to refer to as the new triology of our lives: mask, hygiene, and distancing. So as we go into the weekend with this new way of life that we will have to adapt to, I would like to reflect with you a little bit on masks, on this thing on my face and on all of yours, and why we now have to wear this. And the best analogy that came to mind recently to me was a few years ago. I was invited to a university in Ghana called the Aseshi University, and I was speaking to the founder, and he told me that in his university that students, and this was in a master's class, said that they didn't want any invigilation during their exams anymore. So, I thought, how can you have exams without an invigilator? So he said the students said that the exams and the knowledge they're acquiring means too much to them to require somebody to supervise whether they're copying from each other. Meaning that they will hold each other accountable for their exams because they do not want to belittle the degree that they will get. And it was childish at a master's level to expect that behavior is only regulated by enforcement. And I think this analogy is so apt when we think of wearing masks. Masks are not something that we want the police to enforce, or that will require just another government intervention that has been imposed onto us. This is something that we're saying it's important for us to survive, to keep our families safe, our friends alive, people that we care for, and ourselves. So this is not something we're doing because government is now saying we should wear masks. It's something we need to do for ourselves. And to do it for ourselves means we don't need any supervision. We don't need the chairman of the presidential task force. You don't need the policeman stopping you on the road to insist that you wear a mask. Why am I saying this? In many parts, we've been hearing anecdotes of taxi drivers having masks that they give people when they enter their cabs to wear so that the police doesn't stop you. It completely defeats the purpose of these measures. So this is really an appeal to ourselves and all of us that despite how challenging it is, to remember that these are life-saving measures that we need to carry out for ourselves. The other thing is also to think about what are the appropriate masks to wear. A mask like this is enough for anyone among us that is going out in public. If you can afford a surgical mask like some people are wearing in the room, all well and good. And that's our advice. The highly specialized N95 masks we advise to be used in hospitals and in people providing care. But there are also exceptions where people are at specific risk for all sorts of personal reasons that they could do that. But in terms of the categories of masks and how they're used, this is how we think about them. We also advise if you're wearing a mask like I'm wearing today, please remember to wash them every evening. That means it would be good to have a few. Just like you have other clothes, you can get 7 and you wash them over the weekend and make sure you have a clean one every day. The other key thing to remember is disposal. If you're wearing a disposable surgical mask, it's important that we think about disposal. There are many ways to do this safely. You buy one of these polythene bags, you put them in, tie them up, and put them in the waste. Just to put them away and get them away from people picking up masks to sell, reuse, and dispose of casually. Because disposing and picking up any of these masks, like some of you are wearing, can also add to the risks that we all face. So we've gone the extra mile to put up actually a guidance on masks on our website. This normally would not be necessary, but we hope that this can guide some of the actions that we're going to take over this weekend. So I wish you all an excellent weekend, one filled with joy and happiness, but always remember mask, hygiene, and distancing as we enjoy our weekends with our families. Thank you very much.
The Chairman of the Presidential Task Force, honorable members, ladies and gentlemen of the press, good evening. So my theme today will be on the issue of stigmatization of persons diagnosed with COVID-19. As we know, the COVID-19 is a novel virus and the disease itself is new. And like with anything new, there's a lot of, it comes with a lot of uncertainty, anxiety, and fear. However, this fear should really not make us lose our humanity. Since the outbreak and spread of COVID-19 in Nigeria, we have observed increasing levels of stigma associated with the disease. And this leads to a number of issues. In the first place, stigma is a major setback to the COVID-19 response. Persons that are undetected may fear having a diagnosis because they might fear that they will be discriminated against. And the virus will continue to spread and challenge our efforts to identify, trace, isolate, and treat if these persons do not present for testing. This will greatly undermine the national emergency response to our pandemic. Secondly, stigma can also drive people to hide the disease. We know that persons infected with coronavirus could stop reporting symptoms if they observe that others that are infected are being discriminated against. We must be able to show empathy. Infected people can also increase the risk of transmission to our communities, including our healthcare workers, whom we have to protect. It is important that persons that have symptoms consistent with COVID infection come forward and share their history and possible contacts so that we can isolate, test, and treat them. Stigma also prevents people from seeking healthcare immediately. As we all know, the goal in this response is to make sure that people are diagnosed early, they are moved to a place where they can be isolated and treated so that we can interrupt transmission. But with stigma, this goal is defeated. People will end up resorting to ineffective home remedies, which have not been scientifically proven to work and can lead to an increased risk of death and also further spread of the virus to their loved ones and the rest of the community. Being that this is the end of the week, I thought we should really appreciate all those that continue to support the PTF and the national response. You may be aware that some of the newspapers today carry adverts with regards to the list of Nigerians that have contributed to the COVID-19 response, and we are all very grateful to them. In particular, I would like to reiterate that we are particularly grateful to the Africa Finance Corporation, Folorunsho Alakija, Chief Mike Adenuga, Deji Adeleke, and Rahul Savara. But of course, no amount is too small. We all thank you for your generosity.
Thank you very much. We shall take two quick updates from the Honorable Minister of Humanitarian Affairs, Disaster Management and Social Development, followed by the Permanent Secretary, Aviation, on behalf of the Minister of Aviation.
The Chairman of the PTF, members of the PTF, distinguished ladies and gentlemen, good evening. Yesterday, the Ministry of Humanitarian Affairs, Disaster Management and Social Development flagged up our biggest COVID-19 intervention under the modified school feeding program in Kuje, here in Abuja. It had a huge turnout, and many beneficiaries left happy and grateful for the intervention, especially at such a difficult time with the pandemic posing health, economic, and humanitarian challenges. I was joined by Paul Haw, Country Director of the World Food Programme here in Nigeria. The WFP is providing technical support because defeating hunger is not just part of their mandate, it also aligned with SDG 2, which is focused on achieving zero hunger by 2030. Now, let me take a few moments to address the massive misrepresentation and misunderstanding around the National Homegrown School Feeding Program, which the ministry was directed to resume via a presidential directive of March 29, 2020. For clarity, the program, which is funded by the federal government of Nigeria, is implemented by the state governments and facilitated by the Federal Ministry of Humanitarian Affairs, Disaster Management and Social Development. And this program, as modified, is targeted at heads of the households, guardians, and caregivers of these children, the primary school pupils 1 to 3. And also, we are not spending 679 million per day, as alluded to. That number is inaccurate. The take-home rations are worth 4,200 naira per household, and is planned as a monthly COVID-19 intervention for 3,131,971 households in the participating states of the Federation. When the federal government ordered the closure of schools across the country in order to help flatten the COVID-19, it interrupted the school feeding program, which is one of our cardinal projects as a government and which preceded the COVID-19 outbreak. Because the program was already ongoing, food vendors had already been contracted and mobilized for the project. We are also mindful of the fact that most vendors, having been mobilized and made purchases preparatory to the project execution, it's just not possible to ask them for a refund. And this had been done before the school's calendar was disrupted. In light of this, as I mentioned, demanding a refund will be cumbersome and unrealistic. So the ministry went into consultation with the Nigerian Governors Forum, in line with the directive of Mr. President, to work out modalities on how to continue with the program despite that the schools are closed, and especially because of the exciting challenges posed by this COVID-19. That is how we arrived at the modified school feeding program of taking dry food rations to the households of these children. So how we got our data with children at home was another issue. When children enroll in schools, as part of the registration processes, a detailed register which contains the address of parents and guardians of every pupil is kept with the schools, as well as the class teachers. We also obtain those from SUBEB and other sources. More so in the minute communities where these children live, every child's home can be easily identified by members of that community and the management of these schools. So to ensure full transparency so that the program is not compromised, we are submitting a full list of all the vendors to the EFCC. And let me also state here that these vendors have been in the structure since 2016. So we are using existing structure. It's not a whole new program that we're enrolling, no. It's the vendors that have been in the program that we're using because they are used to providing these food materials to the cooks to cook. We have also invited other agencies of government, including the DSS, EFCC, ICPC, Code of Conduct, and a host of NGOs and CSOs to help us monitor. I'm sure you agree with me. Yesterday, you must have noticed a large number of people participating in the process or in the flag off, because we engage as many stakeholders as possible to be part of that, being very mindful of the social distance guideline. I have gone into some lines in order to disapprove the misinformation and misunderstandings around the modified program and to ask Nigerians to support this proactive intervention designed to keep our children fed during this pandemic, so that the objective of this national homegrown school feeding program is not compromised, i.e., having children being fed with nutritious food, as well as boosting the local economy of these communities. We are working with agro-farmers. We're working with poultry associations that have to, at this point in time, get their products bought, especially when you talk about the eggs that we provide to these children. So we are boosting the local economy. This week, the ministry participated in the United States Institute of Peace event, focusing on exploring opportunities for state governments and citizen partnership in Nigeria's response to COVID-19, alongside Their Excellencies Dr. Fayemi Kayode and Samuel Lalong of Plateau State. We had fruitful deliberations on how to better navigate this monumental and global crisis and evolve strategic humanitarian interventions with maximum impact. I also attended the inaugural board meeting of the COVID-19 Basket Fund of the UN, designed to serve as the one COVID-19 financing and investment platform through which different stakeholders, including UN, other multilateral and bilateral donors, as well as private sector donors, foundations, and philanthropists can channel their financial contributions to the multi-sectoral efforts of the Presidential Task Force on COVID-19 response. As we're all aware that what had started as a health emergency is also now a humanitarian crisis. And areas of intervention include socio-economic interventions around vulnerable groups, particularly on the efforts of the cash transfers or food distribution to vulnerable groups. The government of Nigeria launched the One UN COVID, as we may recall, on 6th of April. So, ladies and gentlemen, the ministry continues to liaise with partners locally and internationally to identify new strategies for intervening and making positive impact during this pandemic, especially to our poor and vulnerable populations. Thank you very much.
Mr. Chairman, sir, the honorable ministers and members of the press, good evening. I understood there was a question about demurrage at our airports. Well, the demurrage charges at our airports are paid directly to the two major ground handlers, SACO and NACO. So we've been in discussions with them. Since this money is not paid to FAN, it's not paid to Federal Airport Authority. It's paid to the concessionaires who are at the airport. So we're in discussion with these companies. We're also consulting with the Nigerian Port Authority to see what they are doing at our ports so that we can have a unified way of addressing this issue. Whether we're going to give them some concession for a month or 2 months or more as this lockdown is on. So I believe this answers the question. Thank you very much.
Thank you. We've taken the updates. Now we take your questions before the responses.
Good evening. My name is Friday Kerigbe. I'm a reporter with Channels TV. First, I would just like the PTF chairman to make a clarification. The total sum that has been donated so far is far less than 800 million. It says 792 and some other fraction on top. We know that in the past, it's been reported that some prominent citizens make donations up to the tune of 1 billion up. So I want to see a clarification so that we do not report something that is not correct. Just clarification. Why is it that in the past there were donations up to 1 billion per person, and now we are having total sum of less than 800 million? So we need that clarification. There's also the question about the Empower that I asked yesterday. Empower volunteers that are still waiting for the payment of their stipends. They actually complaining that the stay-at-home period, many people feel that they are young people and so they are not vulnerable. But that they are staying at home now without payment is actually a very difficult one for them. So why is their stipends not being paid? That was a carryover question from yesterday, now that the minister is here. Now, the question I actually want to ask now is it has to do with the announcement for the hazard allowance and special allowances for health workers, frontline health workers that was made some few weeks ago. When is the start date for the implementation? Because we speak, some of these health workers in the front line are complaining that there is no circular to that effect yet. And we know that in the civil service, circular is what they work with. They don't work with verbal directives like that. So when will be the effective implementation date for that to happen? Then yesterday, one of the very serious concerns that the PTF raised was the attitude of some evacuees in their isolation centers, where they allow friends and families to visit them. Apart from raising that concern, what specific security strategy do you have in these isolation centers to discourage such the reoccurrence of such attitude, and especially so that we also prevent possible escapees from those isolation centers? Thank you.
Good afternoon, sirs. Rachel Abuja from the News Agency of Nigeria. My first question is for the Minister of Interior. Sir, it's quite obvious that our interstate movement is not being 100% achieved, to say, because of the pictures we see from Kaduna, Katsina, Enugu, and other states of the Federation. And there are also alleged cases that our security agencies are being compromised. I would like to know what your ministry will do to further curb this so that it won't affect our fight against COVID-19 negatively. My next question is for the Minister of Health. On record that the federal government hospitals treat COVID patients, but I would like to know who takes responsibility for their medical care. Is it the hospital management or the PTF? My next question is for the DG NCDC. Sir, your agency notified norms for which lab and private lab can get accredited for lab testing, for COVID testing, to say. We had a voice pop speaking to lab owners across the country, and some of them said that they've actually sent their applications, while others said that because of it's not sensitive to the present economic we have in the country. So I don't know, with our 25 labs at the moment of network, I don't know if the DG is aware that the University of Jos Teaching Hospital also have capacity to test for COVID. And comparing what we have now in our network with other countries, I believe we can test for 10,000 per day. I'm not a statistician, but from data available, and I don't know why we are not looking at collaborating with health facilities in order to collect samples to test. More so, why are we also not considering the use of rapid diagnostic tests, especially by these same private health facilities, as a screening and surveillance tools, whereby positive from this test can be confirmed using the RT-PCR platform. Thank you very much.
Good afternoon, members of the Presidential Task Force on COVID-19. My name is Yemi Adebayo from AIT. My first question is to the PTF as a whole. I want to find out, I understand that this week that we are is supposed to be the final week for the first phase of the gradual easing of the lockdown. And I want to know, when should we expect the second phase, the guidelines for the second phase to be issued out? Then the PS Aviation, so I'm glad that you actually talked about the impasse between importers and NACO and SACO on the issue of demurrage. These negotiations you are having with SACO and NACO, how soon are we to expect results? Because we understand now that work is currently not ongoing at that part of the airport. Then the Honorable Minister of Humanitarian Affairs, I want to find out, is it true that beneficiaries of Empower have not been paid their salaries for the month of April? Then the DG and CDC, sir, could you please enlighten Nigerians? Because a lot of people want to know what the difference is between malaria and COVID-19. Because a lot of people who have recently been discharged from isolation centers come back to say that the treatments they are giving, the drugs they are being administered on, are malaria-related drugs. I want you to please clarify what is the difference between COVID-19 and malaria. Then again, I also want to bring to your attention, sir, a case in Kefi in Nasarawa State. There's a man there now who has been taken there about 2 Sundays ago. Test was carried out on him, and the authorities came back perhaps about 2 or 3 days ago now to tell him that they are still not sure of his status, whether it's positive or negative, and he's still there now. I want to find out if perhaps there's anything you can do on that. Then as a follow-up to my question yesterday on the directive that essential workers should be allowed to move freely, yesterday again, the same scenario I painted yesterday happened. And at Kugbo and Nyanya axis. And these security operatives make me understand that there is difference between lockdown and curfew. And that the curfew, the directive that I was given to them is that whether you are a non-essential worker or you are an essential worker, there should be no movement after 8 p.m. Then, finally, I want to find out on the response of the issue of those who are supposed to attend to patients at various isolation centers. So many people are complaining that the kind of treatment they get are not so palatable. I want the Minister of Health to also respond to that question. Thank you.
The SGF, sir, honorable ministers, and my colleagues, good evening. My name is Rahila Lassa. I report for Voice of Nigeria. My question goes to the Director General NCDC. I want to know the number of tests carried out daily in every state. So Nigerians generally want to know which states are doing the test and which are not. Then secondly, we've noticed a drop in the number of cases in the last few days, and the Federal Ministry of Health says it has ramped up its testing capacity. But again, there has been complaint by the PTF of non-compliance with the guidelines. So what's the relationship between this? Thank you.
Good evening, the SGF, honorable ministers, and my colleagues. My name is Femi Akonde. I'm a reporter with TVC News. My question is to the Honorable Minister of Health. Honorable Minister, sir, yesterday, your response to the whereabouts of the Chinese medical team or supposed medical team further stirred controversy around an already controversial subject. And people are asking, we heard you say that Nigeria is expecting a team of medical doctors from China to assist in the fight against COVID-19. The NMA, Nigerian Medical Association, kicked against this, and then you said again that they won't be taking care of patients. But yesterday you didn't sound sure about the qualifications of these Chinese people. You said maybe you don't think they are all doctors. And people are asking what is going on. If you've been following the conversation on Twitter and even other social media spaces, people are saying that it appears as if the government is not telling us the truth about the status of these Chinese visitors. I would like you to take your time to clarify these, sir. And the Honorable Minister of Foreign Affairs, the world is changing in the way we do things, and even our workspace is changing. I would like to ask you, in your ministry, how are you and your staff adapting to the trilogy, as the NCDC DG would like to put it, especially as it concerns social distancing, because now there is need for more space and people like standing meters apart. How is your office adapting to this? Thank you.
evening, members of the PTF. My question is for the PTF chairman and probably the coordinator as well. The PTF has told us on this platform that the welfare of those in isolation centers are catered to by the states. In the case of the evacuees, their welfare is in the hand of the PTF. Why is the PTF not feeding them after the sums of money they've paid for the evacuation? NCDC DG, please, what is the circumstances around the death of the Dubai returnee at the isolation center? Thank you. Okay, I said my question is for the PTF chairman and the coordinator. I said the PTF told us on this platform that the welfare of those in isolation centers are catered for by the states. In the case of the evacuees, their welfare is in the hand of the PTF. Why is the PTF not feeding them after the huge sums of money they've paid?
Good evening. My name is Nike Adebowale. I report for Premium Times. My question is for the Minister of Health, sir. So while responding to questions yesterday, you said, and I quote, "These unexplained deaths did not only occur in Kano, but 8 states of the Federation." So I'm only aware of these deaths in Kano, Jigawa, and Bauchi. Can you please give us a list of the remaining states? Thank you.
Muki Alaga àti gbogbo ọmọ ìgbìmọ̀ PTF. Ìbéèrè tí mo béèrè lọ́wọ́ mínísítà fún ètò ìròyìn àti ọ̀rọ̀ àṣà. Àwọn ọmọ orílẹ̀-èdè Nàìjíríà fẹ́ mọ ibi tí iṣẹ́ dé dúró. I want to direct the same question to the chairman PTF COVID-19. Update on the Borno State announcement of suspension of lockdown in Borno State, and that people should go to churches and mosques. We want you to answer it in Hausa, and NCDC director to answer the question in Igbo.
The chairman, national coordinator, members of the task force, my colleagues. My name is Amaka Ude. I report for Arise News. Well, my questions today are more of comments from viewers who sent in their thoughts and comments to the PTF. And the first one actually goes to the DG of the NCDC, and this is a follow-up to your speech earlier. Someone wants to know, can the NCDC DG tell local manufacturers of nose mask the specification for good quality public nose mask? There are all sorts of nose masks out there, and they want to know the specification for the right ones that Nigerians should be using. And finally, this one also goes to the chairman of the PTF. Well, this is a comment from someone who says, data charges in Nigeria are too high for the average person. What can the PTF do to reduce the charges, especially for school children who are having to use data now to learn? Thank you.
Thank you. That concludes the questions. We've taken all of them. They're directed at the Honorable Minister of Health, the DG NCDC, the National Coordinator, the Honorable Minister, Humanitarian Affairs, Disaster Management and Social Development, Honorable Minister, Interior, Honorable Minister, Foreign Affairs, Permanent Secretary, Aviation, and the SGF. Let's begin with the Minister of Health.
Thank you. So I shall start in no particular order, beginning with the question on the reported deaths in Kano. I did say that it occurred in other places, but that 8 pathologists from 8 states had come and have been invited to Kano for training. But I didn't say that it took place in 8 states, but pathologists from 8 states. So There were deaths from other places. They were reported deaths from Azare and, if I remember correctly, I think Zamfara. But these are just the ones that are that have been mentioned openly. So the training has gone on for the pathologists to go to attend not only to the ones that are known, but to the ones that are not yet known or not yet reported. It must be stated that, and I think I should add that as I stated yesterday, there has been some reduction in the activities of treating routine cases because of the scare of COVID-19. So there's been reduction. I did mention yesterday that hospital attendants are dropped, maternity attendants are dropped, skilled bed attendants, immunization are dropped. So as a result of that, we do worry that some deaths may have occurred in connection with or not directly in connection with the coronavirus. It will be indirect if a person couldn't go to get help in a hospital because of the fear of coronavirus or doctors refusing to attend to such persons. So that was that. Now, with the hazard allowance start date, I think the Secretary to the Government and Chair will take that question and answer that one. Now, the complaint about the type of treatment they get in isolation centers, we have said here that those who are positive for coronavirus can either have no symptoms at all, or they have mild symptoms, or some of them can have severe symptoms or critical symptoms. The ones who are critical will get full attention. They might require a ventilator, they might require, even some of them might even require dialysis. Those are the really critical ones. They require critical care doctors. The others who are severe, who have shortness of breath, can get oxygen, they have to be on IV drip and so on. And those with mild symptoms will also get mild treatment, symptomatic treatment, what we call supportive treatment. They might be given painkillers or something to headache. And there are others who have nothing at all, who might be given just vitamins to strengthen their immune system. So on the whole, the treatment is not uniform. And people who expect that when they are in hospital, they must be given medicine, sometimes will be surprised that they are not given medicine, because another thing you must remember is that somebody who comes in without symptoms and is positive can change at any time. It can become severe. There are cases where moderate, mild symptoms suddenly became severe, and the picture just changed. So being in a hospital for observation alone by itself is important, even if you didn't have any symptoms. Now, with respect to the foreign doctors, I don't think anybody has ever reported that they saw Nigerians being treated in a hospital by a foreign doctor. There's nowhere where this treatment is going on. And it's not been reported in any of the treatment centers at all that you saw foreign doctors. All the treatment is done by Nigerians, and is done according to the program which we lay down. So I think that takes care of the question, in that we are not using foreign doctors at all here in Nigeria. I think the other question was about the non-compliance with guidelines. Well, I think the SGF will take that, because it has to do with questions of discipline and organization. So I think that's all for the health sector. Okay, you are talking about who takes responsibility for medical care. Okay, well, part of it is answered. Medical care is done by the hospital, by the doctors. They take care of the patients, and the nurses and the other healthcare givers. They take care of those of all the patients in the hospital. But if you mean who pays for it, I don't know if that's what you mean. Okay, so it's a combined effort, I think, some states pay and the federal government supports, but again, the head of the PTF will answer that question about how the payment is being made. As far as the treatment is concerned, it's done by doctors at state level and supported by federal doctors. Teaching hospitals, federal medical centers, primary centers where particularly severe cases are treated, and then isolation centers. It's a joint effort, usually the state or a joint effort with the state government. That's all. I think that was just your question. Yes, what was yours?
And of course, the mission is not to treat Nigerian patients. You clearly stated that. Yesterday, you said you're not their host, and people said that you welcome them at the airport when they arrive, and you told us that they would provide technical support. They have come with technical set up all of this. But your response yesterday seemed like the interaction of all you have said, and people are asking what really is going on. Will you please clarify exactly what is the current state of these people in Nigeria and their mission in accomplish? Are they still around?
What I stated yesterday is that, first of all, they didn't come here at the invitation of the Federal Ministry of Health. We're not the ones who brought them. They are here with their company, CCECC. That's what I stated. That's what I know. But we didn't apply for them. But we have also seized the opportunity to have interaction online, remote, to say, how do you treat cases? How did you take care of your severe cases? How do you take care of your mild cases? They use traditional medicine in some places. But there's no face-to-face meeting at all with them at all. We didn't have any face-to-face meeting. Yes? About what?
So thank you, colleagues. Let's keep it calm and professional. A few questions on the lab. As always, we're working round the clock to improve lab capacity across board. A big constituency that we're looking at how to bring in are the private sector labs. We have nothing against private sector labs supporting the testing. The reason why the number of tests in South Africa are so high is because their private sector labs were ready to carry out molecular testing. So we've had very few applications, maybe one or two, and what we're now trying to do is define those guidelines. We put them up on our website, and once a private sector lab is able to do the complete package of testing, the biosafety, by all means, we want them to go ahead, and if they want to charge, that's all well and good. Important thing, we get the data on the number of people tested. But for labs that we're going to use public sector resources to support and provide the reagents, there's no commercial pipeline at the moment to buy reagents. So we bring in all these reagents through procurement, donations from the UN. Once we distribute that, then we have to maintain the standards across those labs, and that is what we will continue to try to do. Thank you for the information on University of Jos. We have quite a number of places now that are offering this. Teams just came back from Port Harcourt and Yola that just came online. Then Nnewi at the moment, the next destination is Kwara and Katsina. So we keep pushing, but we keep pushing and we try and cover as many labs as possible next week. The rapid diagnostic test kits. To be honest, I've said this severally. Once there's a rapid kit that we know works, we have rapid kits for malaria, for HIV. They took years to develop, right? We're 3 months into this disease. So also speed is not always an advantage, right? So we're working very hard with studying the evidence. As soon as there's a rapid test kit that works, we will offer it. We will say, listen, this is a test kit that works. But we don't have that evidence yet. So I know that people procuring, my responsibility, whether it's good or bad, is to provide the best scientific advice I possibly can to my government, and that's what I'll continue to do. There are pressures on the commercial side, on the ease of doing business side, to approve kits, but my responsibility is to make sure that whatever we're using provides healthcare professionals the answers they need to make informed decisions about clinical management. So the other question on malaria and COVID are different. I mean, I won't go into that. That requires some attendance of medical school to go into all the differences. But I think we all know COVID is a respiratory illness caused by a virus. Malaria is caused by a parasite. They are completely different diseases. However, many diseases in our context present exactly the same way in the beginning, right? Yellow fever presents the same way with the fever at the beginning. Lassa presents the same way. Malaria presents the same way. So the initial presentation of a febrile illness is very similar across diseases. There's no specific treatment for COVID. So what clinicians do is to manage your symptoms so that the body recovers as quickly as possible. So sometimes they try, if you have, because you can have malaria and COVID. So by the time you're in hospital, there's no reason why that you have COVID doesn't prevent you from having malaria. And if you're in the hospital for 1 month, you could definitely be co-infected by both of them. So there are very many reasons why people receive similar treatments here and there. But there are two completely different diseases with different pathogenesis. On the result of the patient in Kefi, yes, you know the right thing to do. The clinicians can inform us if there's any problem through their state epidemiologists. The chair of the task force for the management of COVID-19 in Nasarawa State, Dr. Akabe visited us last week. We talked about the general response to the outbreak in Nasarawa. They're trying very hard to improve that. But I obviously can't comment on the results of one specific individual, and definitely not at the press conference. The drop in the number of cases. You see, it's never good to interpret rises or drops in days. So when you see 1-2 days of an increase or a decrease, you will never see me come out and say cases have increased or decreased. We look at trends over time, and we will continue to monitor this over time. And if we do see a consistent decrease, then we'll be happy. But it's way too early to interpret results on a day-to-day basis. We'd rather take it on a week-to-week or 2-week basis. There was a request by a number of tests by state. That request has come severally through social media as well. Next week, we'll provide the number of tests in every state per week. So that you see that. We'll try and provide that every week. We won't make any comment on it. You interpret it the way you deem fit. We'll put the number out there so that people can come to their own conclusions on who is testing and why not. There's a question of the circumstances of the death of the individual that came in from Dubai. I mean, this was a very unfortunate scenario. We lost someone. Every death is a really sad occurrence, but the clinicians, the managing clinicians have communicated with the family as they should do. They understand the circumstances, and I think they're at peace with each other. So I think that's sufficient to say at this stage. There was a request for specifications for masks. We'll do our best. Remember, the best thing to wear actually the safest thing are the blue, simple masks that you're all wearing, or these improvised masks. And the key thing about these masks is really the safety, to keep them washed every day, to take them out safely. You would have seen me when I do it, pick it out from your ears and not open it, not share them, generally keep them as safe as possible. But we will see what we can put out there if that's a request by Nigerians. We're there to serve. And finally, the question on Borno, on why they have eased the lockdowns in Borno. I think every state governor has that's exactly what they are elected to do, to manage these circumstances on behalf of their states. We provide guidelines from the federal level, but the enforcement and of these and how that relates to your particular state and the circumstances in your own state can only be decided on by the state government. So I was asked to also answer that in Igbo. I say, onye isi ala Borno nyawa diakia welie ihe ji mgbochi maka ndị mmadụ ịgagharị. So ọkwa n'ihe ji họpụta ya ka ọ chịa ndị Borno, ọkwa n'ihe ji họpụta ya ka o mere. Ụtọ ọla oshi mere anyị kwadokwana ụtọ. So thank you very much. I think that answers all the questions. Okay, Rachel, which question did I not answer? Yes, absolutely. I need us to remember, today on social media, there's been a lot of noise. I think there was a case somewhere in Enugu that NCDC did not pick up an individual. I think we're very proud of the work that we have done so far. We will continue to work very hard to improve the work we're doing in collaboration with everyone else involved in the response. But remember, NCDC doesn't do everything. The collection of people when they're ill or the collection of samples are a state government responsibility. We provide them guidance, we provide them when we can, the swabs, but the actual sending someone to the patient to collect a sample, picking up the patient when they're ill, are state government responsibilities, and we continue to support them. They're working very hard to do this. It's very challenging. Every day at night when we announce the new numbers for a state, the first thought that comes to my mind is, gosh, Lagos has to find space for 60, 70 new patients the next day. Or Kano has to find a space for 50 new patients the next day. So it is not easy organizing all of these things. And I know the states are working very hard on this. But this is their responsibility. Ours is to support them to carry this out. Thank you.
So I think some of the questions I have already been answered, which is good. We need to save time. So there was a question about who takes care of COVID-19 persons in federal teaching hospitals. We have a budget. We will be approaching the federal institutions through the Federal Ministry of Health to request for evidence and reimburse patients that have been treated for COVID-19 in the federal institutions up to the limit of our budget. Rapid diagnostic tools, yes. So we're not using rapid diagnostic tools at the moment because they have poor sensitivity and they are not as robust as we would like them to. The gold standard remains PCR, but having said that, there are new kits that are currently being validated. We are awaiting WHO guidance. As soon as we have kits that we can rely on, that we know that we can use, then we will start using them. But for the moment, PCR is the way to go for this epidemic. So what's the difference between COVID-19 and malaria? I think Chikwe has mentioned it. It's no different to asking what's the difference between a bird and a goat. I don't know. They are very different, okay? One is a parasite, one is a virus. But of course, if you're talking about the symptoms can be very similar. The commonest cause of fever remains malaria in the tropics. It's not COVID infection. So why have some states lifted aspects of the embargo and lockdown? So as DG NCDC said, it's still within the responsibility of the state governments. What is important is for us to continue to leave those lines of communication open and also emphasize some of the risks, particularly as it relates to people who are elderly, the vulnerable, the ones that we need to protect, those that will end up with very severe illness if they catch this illness. And the principle really is to reduce mass gatherings, because the more you are in mass gatherings, the more difficult it will be to maintain physical distancing. And if you have somebody who is infected with COVID who is in very close proximity to you, regardless of whether you are wearing a mask or not, you're still at risk of catching COVID infection. I think that's all I have for now. Thank you.
Honorable Minister, Humanitarian Affairs.
I think the question is around the payment of the Empower volunteers stipends, their monthly stipends. I would like to say it's in the final stage of payment. By next week, early next week, they will get their payment, inshallah.
Honorable Minister, Interior.
Good evening, everybody. It's a pleasure coming again after a long while. And as I greet Nigerians very warmly, I greet our press people for their keenness and their commitment to enlightening and informing Nigerians. It's been quite alluvial over this period of time. We are at war. We are determined to win the war against the invisible enemy. My question is security compromise, particularly on the highways, and what are we doing? I must admit, indeed, there are challenges. I agree perfectly that it's not been as perfect and effective as we planned, but it will get better. We meet every week with the heads of security agencies as a team, as a task force, and then we raise these issues. We have assurances from them that things will be better. I believe and I know that a very high level official of the Nigerian police force, which is the lead agency in ensuring internal security, in maintaining law and order, has been designated to lead the process of ensuring effectiveness, particularly on the highways. So over the next few weeks, we will see a lot of improvement in the effectiveness of movement control, restriction enforcement on our highways, without a doubt. That said, I want to elaborate on something that was said about 2 days ago here. This COVID-19, having entered the community infection phase, requires community commitment and ownership of the management of the virus, of the infection. And what I understand that to mean is the need for all of us in our respective communities to energize leadership of the community in all aspects. When I say leadership, from religious leadership to traditional leadership, to elite, to business leaders, to even trade leadership, to arouse in the community consciousness, one, for observation and general and easy detection of distressed people attacked by this virus. Work towards creating not large, small community isolation facilities that you link up with, that you can easily link with the local government and ultimately the state to save ourselves from unmanaged spread of this disease. Requires the commitment of all of us, particularly at the community level. This was my own contribution to the discussion on the face of the infection that we are in now. We are at the community infection phase, and it requires the involvement of all in the management of it. I salute all Nigerians that are fasting. We are climbing down the hill of the mountain of Ramadan. I pray that Almighty Allah will accept our supplications. I thank you.
Good evening, everybody. The first question that was addressed to me was a curious question, to my mind, how we practice social distancing in the Ministry of Foreign Affairs. I don't really know if there's anything unique about the Ministry of Foreign Affairs that should make us have a particular protocol for that. I think, well, basically we try to keep to the accepted protocol, cleaning of hands as you come into the building. In fact, as you come through the gate, you will have your temperature checked, and then you will have the dispensers to clean your hands. And we try as much as possible to keep the social distancing and everybody wearing masks. I've had some meetings with foreign dignitaries still, ambassadors and so forth. And we have kept to the general protocol and practices. The second question was in respect of why evacuees who have paid to come home should be paying for their feeding. Now, I think this will give me an opportunity to maybe once again try to really communicate to you what the challenges we're having with respect to evacuees really are. There's been quite a lot in social media, especially after the recent directives that were communicated to our missions, indicating a certain amount of money that anybody who wanted to be evacuated back to the country needed to pay. And that it was not just for the air ticket, but also includes the accommodation for 2 weeks, or maybe 2 weeks and 2 days, and the cost of feeding. Now, this is not by any stretch of the imagination something that the government is happy to do. As I've mentioned time and time again, if the resources were there, we would evacuate everybody, and if our medical infrastructure was solid and our caseload was much lower, we could look at other ways of accommodating, revisit our protocol. But the way things are at the moment, the fragility of our health infrastructure, the trajectory of the increasing numbers of positive tests being what they are, we have to take the greatest care with regards to the protocol we adopt with people coming home. So it's been decided after long discussion and evaluation by the best medical minds that we have, that it is best for us, for the interest of the country, that there should be a period of quarantining when any of our evacuees come home. That has a cost to it. And, one of the things that people have been suggesting to me is that why can we not house them in NYSC facilities, school facilities, which would be much cheaper. And the answer to that, given again by our medical people, is that the quarantining has to be one per room so that you don't have infections and so forth. So it has to be premises that provides for individual rooms. And the only ones we could lay our hands on that are available are hotels. We went to great lengths to get these hotels at the best rate possible. And the amount we could get for Abuja was 15,000 naira. And also, negotiated as best we could for the feeding. Now, with regards to the flights, coming in, one of the real challenges we had was that we didn't want to keep people out there any longer than they needed to be. So for us, we put a lot of emphasis on trying to get as many people back as quickly as possible, and which meant, whatever flights that were available, we would try and arrange with those flights and take them back. Now, there's a lot of uproar about the costings that we've presented for those wishing to come back. As I said, the resources are not there, but we're still looking. We're still looking for resources all over the place, but knowing also that time is of the essence. And for a lot of people, we have to come back. And, so we're making these flights, these possibilities available for those who, really feel that they have to come back as quickly as possible. While at the same time, we are negotiating, we're trying to find what kind of, help, resources we can find to assist as best we can. And that is an ongoing process and ongoing negotiations. So this is, really the situation we have, and we hope that we will be able to, present a package, possibilities that will be easier on our people who want to come home. But for the time being, the resources not being there, we just have to present those costs to our people. Some people, of course, are saying that, why can we not try and pay for the hotels and for the feeding when we get back? But the problem with that is not even with the government, but it's with the hotels, that want the money up front. And, which is why we've made the point of linking it with the cost of the tickets. It's not that it's something that government wants to do, but it's something that the hotels insist on. And we don't want a situation where people will arrive and then we have a huge crisis about accommodation. So that is the situation. And of course, the other thing is that we've brought in now upwards of 620 people. They have to be managed, so there are human resources that we need to have present to monitor and manage them, apart from all the other administrative arrangements that we need people to put in place. So we want to take some time out to process the ones we have back at the moment, and and then before we admit others coming back, because we just don't have the capacity at the moment. So we will, take a little bit of time before we are able to then take on the next batch. But it's a challenging situation, as I said, especially because the funding resources are just not there. But we're doing everything humanly possible to evacuate under terms and conditions that are acceptable and manageable for the evacuees. Thank you very much.
Mr. Chairman, thank you very much. About the negotiations, they are already ongoing, actually. One of the Sako Living offers some discount, substantial discount, and tomorrow there will be another meeting on the same issue. So this is the most updated information I just got. So hopefully in the next few days we should be able to resolve it finally. Thank you very much.
Thank you. We shall now take the chairman of the PTF, SGF, sir.
Try as much as possible to be very fast, because I know our Muslim brothers and sisters will want to go and break their fast. Time is fast gone. And I think most of the questions have been taken by my colleagues, except for probably one. The issue of donations. I thought we had settled this matter. We've totally settled this matter. I have spoken on the issues of donations several times. But for the purposes of finality, let me explain what has happened. There are several sources through which this national response is being funded. Let me start with the big ones. The car COVID, which is a partnership between the central bank and the major banks in this country. As of the last time I kept count of what they had collected, it was about 27 billion naira. That is kept in an account that is managed by that group, the car COVID. It is not under the control of the federal government of Nigeria. They have sourced for these funds from business conglomerates, from banks, and they are managing it, and it's purpose-driven for infrastructure, for palliatives, for consumables. They are sourcing it through their own procurement process. And at the end of it, they would account to themselves through an auditing firm. They've invited me to chair the steering committee for the purposes of coordination, so that we have everything in sync in one direction. The second source of funding comes from the NMPC and its partners. They have even a different arrangement from the car COVID. For the NMPC and its partners, they are not even collecting money. Indicate what you want to do as your contribution to this response. Are you building an isolation center, and where? Are you putting up a lab, and where? And the total amount that they aggregated the last time in terms of the pledges they received from the upstream, the middle stream, and the downstream, plus NMPC as the major player in the oil and gas, was about 21 billion naira. They don't collect money. They have not opened an account. Whatever you want to do, go and do it. And part of it was demonstrated on Tuesday when we commissioned the dome. Car COVID was there. NMPC and its partners were there. CCE and CC, the one that brought in the Chinese doctors, was also there, because they have participated there in terms of provision of infrastructure and equipment that were installed by the Chinese technicians who came along with the doctors. And we have explained this, even with the Chinese doctors, that they did not come on the invitation of the Nigerian government. They are part of a sister organization of CCECC in China that invited them to come and help them in the establishment of facilities as part of their corporate social responsibility. And they are involved in the IDU Railway Institute, which is under the FCT, and the DOM. And they brought equipment along with it, which they have installed. The third source of funding is the United Nations One Basket Fund. They have their processes. They have received contributions from the UN family and international donor partners. It is directly under their control. This morning I said it in my speech that we had a meeting with the United Nations humanitarian ambassador. And the purpose of it is to synergize so that we tell them what our needs are. And because of their international connections, they would facilitate procurement much better than engaging in local purchases and getting goods from accredited manufacturers that we will not run into the hands of fraudsters who will buy things that will not work. So these are the three major contributors to this response. And none of these contributors fall under the control of the federal government of Nigeria. The last one is the contributions that we have asked from Nigerians. And in my discussion with the Office of the Accountant General, I requested that publish this thing so that we stop answering questions. And today, he took out about 3 pages in one of the national dailies, The Nation, and published the names and the banks through which these contributions came from. Even these resources is not under the control of the PTF. It is managed by the Accountant General of the Federation. Ours is that when we need money for our work, we place a budget and a requisition, and the monies are supplied to us for us to undertake our work. But we do not control an account for all these 4 contributions that I have said. Monies will be released to us on need basis. And that is what has been happening. So please, I think we should put this thing to rest. There is no billions that have been collected by the Presidential Task Force. I've explained it over and over and over. But I think today's explanation should put that to rest, that we have no control over these resources. Well, my local understanding, the question that has ably been answered by the medical experts, the difference between malaria and COVID-19. My simple understanding is that they have explained it in the medical terminology, but my own, the simple one that I understand, one is infectious, the other one is not. Because I can live in the same room with somebody that has malaria, but I can't live in the same room with somebody that is infected for fear of being infected. But with malaria, you can even share a bed with somebody that has malaria. So I think I'm simplifying it so that the listeners at home would understand that there is a clear difference between COVID-19 and malaria. And in my speech this afternoon, I did say that some of the sicknesses mimic and portray the same symptoms. So the cure of those symptoms should not be assumed as if it is the cure for the virus. So I think that is my ordinary understanding about that. Data charges, I agree with you, Amaga, that probably we need to talk to the service providers through NCC to appeal to them that now that students are availing themselves with the processes of e-based learning, they should consider as part of their own corporate social responsibility too, to lower the charges on data. That would go out, we will talk to NCC, and by extension, the Minister for Communications and Digital Economy, so that we can have that done. I think the other questions have been answered by Sani and Dr. Chikwe. And I believe time is fast spent, so we'll release you so that most of our Muslim brothers and sisters can go and break fast. I wish you the best of the weekend. Thank you.
Thank you very much. That brings us to the end of today's national briefing. But before we go, let me just clarify. At some point during the briefing, viewers at home saw the SGF looking through the newspaper, the Nation newspaper. Someone sent me a message thinking he was reading newspaper while the briefing was on. No, he was not reading the newspaper. He was looking at the list of donors published by the Accountant General of the Federation. And that's the same newspaper he raised when he was closing the session just a minute or so ago. Well, we must thank you for staying with us this afternoon. We look forward to seeing you on Monday. But before we go, just take this message. Dr. Chikwe struck a note when he was speaking. Behavior for safety and survival should never become a subject of supervision and enforcement. Help yourself, help your loved ones, and help humanity. When we say that you should wear a mask, please wear it. It is for your own good. Wash your hands. It is for your own good. Keep safe distance. It is also for your own good. And stay home, stay safe. It is for your own good. God bless Nigeria. We hope to see you on Monday by the grace of God.